Thank you very much for inviting me to be here today, and it's terrific to see so many people here. And it is terrific also to be able to have the opportunity to talk to you about what was, I think, without doubt, one of the most extensive discussions and extensive reviews that's actually ever been done about looking at vulnerable children in Australia. And I think even some of those that are appropriately critical of reports like this have now acknowledged that it is one of the most extensive reports. I think it's probably sensible to try and just give a bit of background to why this is actually an important discussion. It's important for a couple of reasons, and some of them are quite unique. First of all, it's, if you can cast your mind back to an election a couple of years ago here in Victoria. And I have to say, I don't think I've ever been involved in listening and observing an election where vulnerable children and the child protection system was actually a political issue. But it was. And while it's naive to suggest that it made the difference in terms of the way people voted, if I go down the number of issues that were talked about in that election, I would, in my professional opinion, probably put it as one of the top 6 issues. If you can remember, around that time there were a number of very serious issues around child protection. There were a number of ombudsman's reports. There were a number of critical discussions around the role of the Department of Human Services. And it was one of those underlying questions that became one of those issues in the election that people had in the back of their mind when they were making decisions about how they might vote. So the reason I make that point is that it's rare to think that something as important as one of these really social questions that you would be very familiar with, in a sense, becomes central to the political debate. That then carried over with this government when they got into power, and then they decided they would have an inquiry into effectively the child protection system. They asked 3 people to do it. They asked it to be chaired by an eminent jurist, Philip Cummins. They asked, I think, one of Australia's living treasures, Dorothy Scott, to be also part of it, and for some unknown reason they also asked me to be involved. Partly because I think I've had a background in the public sector amongst other things, and they felt that given that this was going to be a discussion about the system, that I might be able to bring something to bear that was able to look at the system as a whole in a way that might make a difference to the way in which the lives of vulnerable children and their families operate. So this was a really important sort of political issue as well as a critical social policy question. So this is a really important discussion. I'm going to cover a number of points today, and I'm going to have to do them relatively quickly because of the time that's available. I'm going to talk about the way in which the report restates and reinforces some really important principles. I'm going to talk about the report, the way it actually looks as almost like a comprehensive blueprint for our ongoing reform of the system for protecting Victoria's vulnerable children. I think it's an important report because it also gives the community sector an important opportunity to act collectively and individually to advocate for what we need to do for the system of Victoria's vulnerable children and their families. And I think it also, the report, and I'm going to cover this in not too much detail, but hopefully at least give you some indication of the sorts of things that are at the back of our minds. I hope that it gives individual relevant organisations in the public and the community sector a framework for the way in which they might be able to do something for what are effectively the most vulnerable people in our community. Let me give you some of the main points in the review, and I'll go through these very quickly, and I'm then going to give a bit more detail about it. The first point is that the community concerns, as articulated in that, as I discussed earlier in the election campaign, are in fact justified, and I'll give you a bit of a sense of that. Child abuse is a crime. It's a crime. And what we wanted to do was to make it clear to people we are talking about criminal activity when we are talking about abuse and neglect of children. And so we wanted to reinforce that particularly important issue. We wanted to make it clear there are multiple causes of vulnerability for children. We wanted to talk about the system as a whole. And what that meant was we wanted to talk about the functions, the organisations, and all of the interrelationships that go to make up a system. Importantly, we also wanted to put to bed this idea that this was a wicked problem. You understand what I mean by that. A problem that has no solution. And we believe that if we could somehow define the system, we would be able to put to bed that silly idea that this is such a problem that it has no solution, because it does have solutions. Slow, difficult as they are, but there are some solutions. We also highlighted in the report that we needed to operate on multiple fronts, and I'll come to that. There are urgent things that can be done and urgent things that can make a big difference, but there are also some things that will take some time to implement. But there are practical issues that won't cost money, that are about the way people act and respond to this difficult issue that could make a difference right now. And I'll come to some of those. And we also highlighted the fact that it wasn't just enough to have a report like this. What we needed to do was to put in place a monitor, a credible monitor that could report not only to the government but to the people of Victoria about how we're going, and that acted as this champion for vulnerable children and their families. And then I want to just very briefly give you a sense of what I see the government's actually doing, and you can make up your own mind whether that's adequate or not. Let me just talk for a minute about those community concerns and where we felt that these community concerns are justified. I'm going to go through a number of bits of information very quickly. For example, in 2010-11, there were 55,000 reports to DHS about vulnerable children and possible abuse. Think about that, 55,000. There were 7,600 cases reported to DHS where those concerns were justified. But what we also know is that 7,600 cases that were found was really the limit. DHS has got to that limit now and has been running at that limit almost for a half decade. So it's probably limited by the resources that DHS is putting into considering those 55,000 reports about vulnerable children. What we also know, of course, is that the number of reports is growing at 4% a year, much higher than the population rate. Let me give you a sort of a startling way by which we might think about that. A child who is born today will have a 1 in 4 chance of being reported to DHS before they're 18. Think about that. A 1 in 4 chance of being reported to DHS before they turn 18, if these numbers continue. But think about this. There are some parts of Victoria where that number is 1 in 2. Think about that. We also know that Aboriginal children make up 1.2% of the population, but in terms of the child protection system, they are 14% of the child protection system. There are children in this state today that have anything up to 10 reports. The educational performance of children in care, particularly those in residential care, let me try and frame this. There are around about 500 children in residential care in Victoria today. There are around about 4,000 children tonight who will be living away from their homes. Some of them will be in kinship care, some will be in foster care, but there are 500 who will be in residential care. And many of you in this room will be looking after some of those children. You're doing a wonderful job. But what we know about those 500 children is that half of the 500 have an educational outcome half of the average of all other children in Victoria. Think about that. You know what education provides the children. And if we have a group of kids on an ongoing basis who are getting half the level of the rest of the kids in this state, what it actually means is those kids are going to struggle for the rest of their lives. But it's only 500, and we actually could do something about that. And very importantly, as I alluded to earlier, there are regional differences. There are some parts of Victoria, of course, where the number of reports and verified level of abuse is low, but there are others, like the ones I mentioned earlier, where they are significantly higher than the average across the state. If you move by really the financial cost, let me give you just a sense of the financial cost. For example, the lifetime financial cost of abuse that occurred for the first time in 2009-10 in Victoria is between 1.6 billion and 1.9 billion. My discipline is economics. So that matters to me. So just think about that point. So that the abuse that happens in that year will have an ongoing effect, effectively for the life of our economy, of 1.6 to 1.9 billion per year. In 2010-11, we as a state spent 700 million on child protection and related family services. 700 million. The average cost of keeping a child in out-of-home care is around $100,000 per child, and in residential care per year is around $200,000 on average per child. So I hope that you would see from just if you're driven by the numbers, it's in everybody's interests to do something about this. So let me then move on to the other issue, and that is child abuse is a crime. The report, and the report's an extensive report, it goes to 700 pages, there's 3 volumes, and we've tried to make it relatively easy to read. But as you go through the report, what you will see that we try and make the very important point that child abuse is a crime and in many cases should be treated as a crime. The system for protecting Victoria's vulnerable children needs to accept and take account and to be resourced to accept the fact and address the fact that many of the abuses of children are in fact criminal activities. But at the same time, of course, and I don't want to be too negative about this, what we actually see is that there are a number of people who are accepting that and are beginning to put in place processes which will address child abuse and child neglect as a crime. For example, there are what's called multidisciplinary centres, where DHS is working with the Victorian Police in very nondescript buildings around the state. We have 3 of them, and to the state government's credit, it's going to put in another 3, are working very carefully, very diligently to make sure that when these crimes happen, particularly around sexual abuse, they're able to do so and address that matter very quickly and in a very professional way. But the general point I'm trying to make here is, because child abuse is a crime, we need to make sure that we don't become too sanguine about what it is we're talking about. Because if we really are to address this issue of child abuse and neglect, we also will, as a community, have to face up to the fact that these criminal activities will have to be treated as such, and people will have to be held accounted for the criminal abuse that's happening to many of our children in this state. The other issue that we tried to address in the report was that there are multiple causes of vulnerability. And again, I think this goes to the point that people were trying to say to us when we started our require. They're saying, oh, this is an impossible, this is a wicked problem. And of course that really made me mad, because it seems to me that really treats us all as though we're absolutely stupid. And so what we then tried to say to ourselves was, well, let's try and break this down into manageable parts. And unsurprisingly, of course, what did we find? We find that there were multiple causes of vulnerability amongst children. For example, a history of family violence is a reasonable predictor of the way in which we think about the likely vulnerability of a child. Alcohol and other substance abuse, mental health problems, intellectual disability, parental history of abuse, and situational stress, which of course could mean all sorts of things, not only situational, emotional stress, of course, but also economic stress within particular communities. Now, the reason why it was important for us when we were doing this review to break these down into these constituent parts was because we knew that if we could do that, then we could start to address these particular areas of vulnerability in a much more coherent way, We could start to think about what do we do about family violence in a way that would try and address vulnerability for children. We could start to think about alcohol and substance abuse and the way in which it affected children. For example, we could start to say, which we don't do at the moment, we could start to say to some of these adult services, when an adult comes to you about alcohol and drug abuse issues, do you ask them about the children? Do you ask them whether you're going home to children? Do you ask them whether there are children in your family that are now being looked after? We could ask ourselves the question, do the acts of Parliament that drive the actions of public servants address these sorts of issues in those same sorts of coherent ways? Surprisingly, or maybe unsurprisingly, what do we find? Well, they actually don't. And so issues around the health system, they don't say in the various acts that drive the activities and the actions of not only parliamentarians but public servants. It doesn't require them to ask these questions about the child when they're looking at things like alcohol and other substance abuse or mental health problems or even intellectual disability issues. So it was important for us when we were doing this report to try and break this down into a series of constituent parts so that we could begin to look at this whole issue. The other thing, of course, that we wanted to do was to think about this as a system. That is, a system for caring and protecting for vulnerable children. But what do we mean by that? What do we mean by that? What we meant by that was asking ourselves the question, what are the functions? What are the organisations? What are the appropriate interrelationships which, when brought all together, can create an effective and efficient system for addressing vulnerability in children and for addressing the needs of the families of vulnerable children. And again, but this will be no surprise to you, of course, what do we find? We find that this system is made up of communities. It's made up of universal services and their providers. It's made up of specialist adult services. It's of course made up also of DHS. It's made up of, very importantly, community sector organisations. It's made up of the courts and their related services, and of course there are oversight bodies. The important point about us trying to define the system was it gave us the opportunity in this report to look at each element of that system and ask ourselves to what extent were any of those or all of those organisations that form part of the system doing what was appropriate to protect vulnerable children and to enhance the capability of those families. And I think it's fair to say that in almost all circumstances we found those organisations wanting. And for those of you who are interested, you should go back into the report and look at that, and I'll talk about one element of that in a minute. But very importantly, what we were also trying to make clear was that DHS is one, but only one element of the system. And if we are relying on DHS to resolve the problems around vulnerability in children and to treat crimes against children for what they are as crimes, then we will never have an effective system. They are one and only one player in the system. Now, there are things that DHS has to do to lift their game. There's no question about that. And we made a number of comments about that in the report. But we would be wrong to think that if they are the only player, and we need to go beyond that to understand the system that actually is able to meet and to care for vulnerable children. The report also talked about the way in which we need to operate on multiple fronts if we are actually to meet the needs of vulnerable children and their families. For example, we do need to take into account prevention, early intervention and responsive and timely action. The number of people who would come along to us and talk about this question about prevention, early intervention and so on, and how that was where the answer was compelling. There were many people, as you would imagine, who would come to a report like this and say, they're the answer. That's the answer. The question for us was really twofold. First of all, where's the evidence that that's the answer? And there wasn't a lot of it. There was some international evidence that that's the answer, but there wasn't a lot of evidence here in Victoria about that's the answer. Now, most of us can intuitively believe that prevention and early intervention is part of the answer. But what we were trying to say in this report is that if we are going to address the question of vulnerability in children and try and help families of vulnerable children over the long term, we just can't guess about it. We have to, as a community, start to ask ourselves some questions about what really works and be honest about that. We need to put in place a range of evaluation mechanisms to be able to evaluate the many quite innovative programs that are going on around the state, and also the innovative programs that are going on also around the country, to try and ask ourselves, well, really, what works and what doesn't? Because if we are going to address the question of vulnerability in children and to help their families, we've got to stop guessing about this. We've got to get much more serious about building this on a much more fundamental and scientific basis. And we also came to the view, of course, that by clearly defining the roles of these various organisations, we were much more capable of being able to operate on multiple fronts. The report highlighted 10 major system reforms that we thought would make a difference. We thought that what there is needed to be as part of these 10 major reforms was a vulnerable children and families strategy. That's the responsibility of government. They have to put that strategy in place. There needs to be clearer department and government agency accountability. And I'll come and talk a little bit about that later on. There needs to be an expanded vulnerable child and family services network. The current network is inadequate. The current network of bringing together service providers, the work of those organisations that make up the system, and the bringing all of that together within a framework that DHS can work with, is simply not adequate at the moment. There needs to be an area-based approach to co-locating intake elements of the system, of course with community sector organisations, with clear accountabilities for the statutory intervention. Remembering that what we've got going on here is the need for statutory intervention when we see a level of vulnerability that requires intervention in the life of the child, but at the same time there's a need to look at preventative measures with families to try and address vulnerability before we require statutory intervention. At the moment, the governance arrangements are not there to make that clear, and that has to be resolved, and it can be resolved. We need to improve the community sector capacity with a very clear set of governance and regulatory frameworks. I think Victoria should be proud of the community sector organisations that we have. They do outstanding work. And I'll come back to that in a minute, but we found that there were issues where that needs substantial strengthening. There also needs to be a substantial strengthening of the regulatory and the oversight framework, and I'll talk about that in a minute. There also needs to be a very practical plan for self-determination for guardianship of Aboriginal children, particularly in out-of-home care, and particularly those from culturally and linguistically diverse backgrounds. It was very interesting that in some ways that group of, what we call COLD group, the culturally and linguistically diverse groups, have almost been a forgotten group in this area of vulnerability. And we had a number of people, particularly those from Muslim backgrounds, who were saying to us, nobody actually measures that we're in the system. Nobody takes into account our cultural needs. Nobody thinks about whether, if a child has to be taken in care, they're put in with a Muslim family or with a non-Muslim family. So there are a number of important cultural questions that are currently lacking in the system that we can really do something about. It would make a really big difference to many of these children, and actually make a very big difference to the families of these children. And we also need, I think, a sector approach to education and training. What we found was that there was a large gap in the understanding of the sector as a whole about what might be the needs of the sector over the long term in terms of being able to provide services to vulnerable children and their families. We also thought that there were some elements of the system that required urgent attention. So let me give just a couple of elements that require urgent attention. And when I mean urgent, I mean like now. We need more effective early intervention and early evaluation reports to DHS. At the moment, what we've got in the jargon, and many of you would understand that, is we're getting a whole bunch of false negatives and false positives when a child is reported to DHS. That doesn't have to be the case. And DHS has to really do something about making sure that they're doing the right level of evaluation so that they're getting the right child when they have to intervene. Not all of the children that are subject to intervention need necessarily have to be required to have that intervention put upon them, but there are others where we're too slow to do so, and DHS needs to do something about that. We need to think about the way by which the Children's Court goes about its work. We need to restrict the involvement of the Children's Court in the life of some children, and we need to simplify the work of the Children's Court. For example, we in Victoria demand children to go to court when there's intervention in their lives. I don't know how many of you who have been to the Children's Court, but it's a deadening experience. If you want to see children who are fearful of what life might hold for them, go and look at what happens to them in the Children's Court. Children's Court does a generally good job, but they don't need to go to court. People can intervene on their behalf without these children hanging around and listen to the debates about their lives that are going on around them with no certainty about them. If they're not traumatised before they go into the Children's Court, they'll be traumatised when they come out of it. We also need to reform what's called the Children's Court Clinic. Many of you wouldn't be aware of what the Children's Court Clinic does, but the Children's Court Clinic is the major provider of psychological services to the Children's Court. It needs substantial reform. It should be disbanded and be reformed in a much more appropriate way. We need to clearly define the roles and responsibilities of the community sector, and we could do that now. The community sector is such an important part of the provision of services to children that we could actually do something about strengthening that sector, defining more clearly what the roles are, and it would make a very big difference almost overnight. We do need to reform some elements of Child First. We do need to reform DHS's regulatory roles in relation to the community sector. And we do need to demand that all government departments, I mean all of them, meet their obligations to Victoria's vulnerable children. And in particular, we need to demand that the Department of Human Services, the Children's Court, the Department of Education and Early Childhood Development, and the Department of Health do what we require of them for vulnerable children. It was interesting, one of the things that happened was we asked the Department of Health how many people they employed that were looking after the issues of vulnerable children in the Department of Health. There were 2. Now that doesn't mean that there aren't hospitals around the place, that when vulnerable children arrive, and if a doctor, when they arrive in emergency, sees bruising on the child, that they don't report it. Don't get me wrong here. But in terms of looking at what is the overarching strategy, basically they're not there. And so we made a number of recommendations about the way in which the whole of government needs to make some changes about what it does and how it goes about doing its task. We made some specific recommendations about community sector organisations. What we tried to do, we tried to clarify the role of government and CSOs in relation to the protecting and care of vulnerable children and young people. We recommended a model for service delivery and the relationship between CSOs and government. We made some recommendations about greater transparency in relation to the funding of CSOs. For example, at the moment, I think CSOs will never be able to know what is the appropriate funding level for almost any of the services which are provided. And we recommended that there were ways by which that could be done and could be done efficiently and effectively. We made some recommendations about the regulation of CSOs. We don't think the regulation of community sector organisations is adequate at the moment, and there is some tweaking that could be done that could make a very big difference to the way in which they operate and the way that then has an effect on the lives of vulnerable children and their families. We recommended significant reforms in the areas where community sector organisations are the main providers in out-of-home care. And again, the report would be able to, you would be able to see that if you go to the report. We made some recommendations about an industry-wide workforce education and development strategy that I mentioned earlier. And the report implicitly encourages collaboration between, and in some ways the integration of CSOs. Now, this will be a very controversial matter for community sector organisations, so I probably should just spend at least a couple of minutes on that. When we talk about meeting the needs of vulnerable children and their families, we are talking about one of the most difficult areas of social policy in the country. It's not a wicked problem, but it's a difficult problem. And what we need is organisations that are incredibly capable of being able to meet those very difficult needs in those very difficult circumstances. That requires organisations with substantial capability. It probably means that size matters. It probably means that size matters because those organisations will have to be able to train and retrain their people as needs change. It probably means that they will have to have a sophisticated risk management system. Now, I don't mean that in the sort of the jargon, the management jargon, but it means that you have to have a sophisticated way by which you ensure that your staff are protected against, for example, accusations of abuse. And on the other hand, you have to protect vulnerable children from the possibility of abuse. And both things have to happen. They take resources. We also need to make sure that we can have community sector organisations right across the state. At the moment we can't. We know that there are some parts of Victoria where there are simply not enough capable community sector organisations to be able to meet the needs of vulnerable children and their families. As you know, there are some very remote parts of Victoria, and there are some very, very small, dedicated organisations that probably don't have the resources or the capability to meet the needs of those very difficult families and their children. So it probably means that if we're going to get really serious about addressing the needs of vulnerable children, we probably will need to also get serious about how we think about working together to either rationalise some elements of the system, have organisations that can work together in a coherent way so that they pool some of their resources, some organisations that can think about how they can collaborate, where they have certain skills and another organisation has certain skills, and to collaborate in a way that can make a difference, and so on. As I said, I know this is controversial, and in the report we try to handle this as a sensitive issue. But I do hope that when you think about that, you will think about that in a way which is seen in the context in which I've tried to place it. That is, it's about meeting the needs of the vulnerable children and those families, and to do so we need highly capable organisations and individuals who are able to do that. There are also some very practical responses by government and government agencies that would make an immediate difference to vulnerable children and their families. For example, we could allocate resources based on proven regional need. For example, the Latrobe Valley is an area with proven need. If we're not allocating resources so that there is a bias towards places like the Latrobe Valley, then we're missing a huge opportunity to really do something valuable. We can strengthen the capability of Aboriginal service providers today. We can ensure certain services are regionally provided. We can make sure that kids aren't required to attend the Children's Court. We can immediately reform the Children's Court Clinic. These won't take a lot of money. They're just a reordering of some of the resources that we've currently got. We can extend the enhanced maternal child care service. By the way, just diverting slightly, that's a jewel in the Crown in Victoria. The whole question of the maternal child care service is an unbelievable service. Most states around Australia would give their right arm and right leg to have a system like that. It's an unbelievable organisation and a set of committed people who make a huge difference, not only in terms of meeting the needs of vulnerable children, but also acting at that other end, the prevention, early intervention. And so we made some recommendations around that. Interestingly, again, in relation to this whole area about prevention and early intervention, simply by extending playgroup services can make a big difference. Because what we know about playgroup services, of course, is they're a means by which particularly mothers can come in an environment where they know that they are relatively safe to talk about issues, and they know that probably DHS isn't going to take away their kids, but they can probably get some services and some advice about what they might need to meet the vulnerability that's operating within their family. So we made some recommendations about extending some of those sorts of areas. We could monitor and respond immediately to underperformance in the educational standards of kids in care, particularly those in residential care. Remember what I said earlier, 500 kids. It's not as though there are a huge number of kids. We know where they are. We almost know every one of them. There's actually no reason why we couldn't have an individual education plan for every one of those kids. It's not as though this is beyond us. 500 kids, it's a smaller number that's in most of our primary schools. So, these things can make a difference today. And so what the report tried to make clear was there are some real things, real practical things that will really make a difference. We can expect and demand that services for adults be aware of the needs of children when their adult clients present around these services. We can establish, and I'll talk about this in a minute, a commission for children and young people. And we can expect what's described as the Children's Services Coordination Board, which is a body set up that's meant to have within it the secretaries of all of the departments to meet the needs of vulnerable children. We can actually expect they do their job. Now, some decisions will take some time. And let me give you just a bit of an example of some which will take some time. Look, it will take some time to develop a whole of government strategy. And so I think me and others will need to be patient about that. Implementing changes to existing laws and changing the cultural practices of organisations like the Children's Court and the Children's Court Clinic will take time. Aligning out-of-home care funding to meet the needs of an individual child, which is one of our recommendations, will also take time. Implementing a plan over the next 10 years to transfer responsibility for Aboriginal kids in care to Aboriginal organisations will take some time. So in the report, what you'll see if you have a chance to read it will be some of these things where we've made clear that this is a strategy that can go for anything up to 10 years. But it is something that's worthy of consideration. But it's also why we said that we actually need an independent monitor and a credible champion, in addition to Bernie Geary that's sitting over here, to be able to make sure that we can ensure that vulnerable children and their needs are continually monitored and, as I said earlier, reported to the people of Victoria. And the role of this organisation, as we saw it, was oversee and report to ministers and the Parliament on all of the laws, policies, programs and services that affect the well-being of vulnerable children and young people. We also saw that this commission ought to be able to conduct its own motion reviews if it thought necessary, a bit like the Ombudsman does now. It also should replace and retain the current roles and functions of the work that Bernie currently does as Child Safety Commissioner. And we also believe that this organisation should assume the very specific powers of the Ombudsman in Children's, Youth and the Families Act. Now let me give you a very brief summary of what the government has done so far. And you can make your own judgments about whether this is adequate. They actually have decided to invest $336 million over 5 years to strengthen and stabilise the system. They've decided to establish a whole-of-government vulnerable children strategy. They've decided to establish a new high-level committee of ministers, chosen by and reporting to the minister. I think they've given, and I think they're serious about this, a broad commitment to focusing resources into geographic areas of greatest need. they've decided to increase support for Child First and family support services. They are trialling case management reform in 2 key sites, Geelong South, West and Dandenong, and they've decided to increase some resources in out-of-home care. So let me then just summarize, and there are a few other things the government is doing. I think that if I was to be as objective as I can about the government's response so far, I'd say I think it's been reasonable in the circumstances. But I think we need to keep watching what happens next, because I think it's the next steps which will really be very important. And I think it's the next steps, which is the full implementation of the establishment of the Commission for Young Children, and the way by which that reports to the community at large about what's happening will be very, very important, and will be a key indicator about how serious the government is about implementing the ongoing recommendations in this report. So let me summarise. It was a broad-ranging inquiry. The report does show, I think, that there are some urgent actions that can be done, and we can now make a difference. The government has responded to some of the report's recommendations, but the report has provided an opportunity, I think, for the community sector to actually influence the ongoing debate about vulnerable children and their families in a way which I think is going to be particularly important. So let me conclude by just saying, can I ask you to really have a look at the report? I know that this is a big report. What we've tried to do, however, is it's 24 chapters, and so that's a big ask. But at the front of every one of the chapters, there's a summary. And you can have a look at that summary, and that'll give you a bit of an indication about whether you want to read any further. We've divided it up so there's also an executive summary that gives you a layout of all of the recommendations and over what time those recommendations should be implemented. So you'll be able to make your own judgments about what the government's doing here. And we did that deliberately. We did that so that in a very transparent way you can look at this and say, well, this is what could make a difference, actually what's happening. And so you can look at that. It's very important because I think for the community sector, what we try to do is to provide a framework, if you like, a blueprint that you could look at and say, we think if we implemented all of those things, that could actually make a big difference to vulnerable children and their family over the long term. And very importantly, what we also tried to say in the report was doing your job well is critically important. Not just doing your job, actually, but doing your job well. Now, in that sense, that's why we were in some ways provocative about particularly community sector organisations think about whether they have the structure to do their job well. It's not that there aren't incredibly dedicated people wanting to do their job well. That's not the point. But the point is, do we have the structure in place which will allow those dedicated people to be able to do their job well on behalf of what is clearly Victoria's most vulnerable individuals, and they are our most vulnerable children. Thank you very much for listening.